This is Dr. Allen with another episode of On the Front Line. Today, I have a young lady who was sent to us by the Public Health Department because she had made numerous phone calls and was unable to find someone to test her. This individual works for a doctor's office, of which her co-worker tested positive for the coronavirus. 2 days after the positive test, this individual developed body aches and then was sent to the urgent care, of which she was tested. I'm going to show you a few things before I get ready. The first thing you'll see is dusk to dawn is the testing location. The date of the test was 3/26. The results came back the next day, 3/27. COVID-19 is the testing virus. Detected is what the patient showed. Not detected is what is perceived to be normal. The rest of the paperwork shows the CDC criteria for reporting the coronavirus. The public health criteria for reporting the coronavirus. This is the paperwork that must be sent in once you find a positive coronavirus. This is our second positive test as we've served this community. There are a few things I think we need to know before I get ready to go out and talk with the patient. Number one, the KN95 mask is only good for 5 hours. When we reuse these masks under the pretense that one, there's a shortage, and two is that we're covered, we're not. The KN99 is the best mask. That mask lasts up to 3 weeks. Again, the KN95 is only good for 5 hours. There's also other misnomers that you're missing. One, you can get retested for the virus, and after you've been retested and found to be negative, you're good. But the bad side of that, once you're exposed to another positive coronavirus person, you can get the illness again. So that perpetuates the spreading of this illness. I'm going to get dressed, and now I will go speak with the patient. You know, you work with other employees at the facility, and if I'm not mistaken, that the patient tested positive, or was one of the co-workers that was positive. And I just want to make sure the public health department did send you to it. You accept for the coronavirus. Now, it's important that your other healthcare workers come get tested as well. Here is the detective, this is your copy. Here is the information that we send to the Public Health Department. They're going to be contacting you. And here is the information that was reported to the CDC. So these are all your copies. Healthcare workers are at risk. The young lady herself works at a physician's office. One of the co-workers was positive for the coronavirus. She was sent to be tested, and she turned out to be positive for the coronavirus. Healthcare workers are at risk. If anybody in your family is sick, they must immediately come to be seen right now. And if there's any other healthcare workers, you must notify everyone and have them come to be checked now. This is a deadly virus. As you've seen, we just had a death in the Lancaster area. We are all at risk with this coronavirus, working around other healthcare workers, and so am I. This saga is everybody's fight, and we're all at risk. The Frontline Brigade is here. We have 4 sites available now for testing in 4 locations. It is very important that you get tested early in order to try to combat this disease. There's a lot of misinformation out there. If you're having symptoms, you must get checked. Did you have any symptoms prior, just a fever or cough? Body aches. Body aches after exposure to positive co-worker, and now the patient is positive. Please get yourself checked.